some x-rays. And why do you not want to just trust the x-ray report that a radiologist sends to you after you get imaging done? And here's why we're going to show you. You don't want to just trust the report. So I'm a specialist of the spine. I fix and correct spinal issues. So a lot of subluxations, damages in the spine, spondylolisthesis, you name it. A lot of this stuff can be fixed, including disc height. Now, it takes a long time, and you don't promise that to a patient, especially if it looks like this. But what we've got here is we've got a report that said that this area here had a subtle aneurysthesis or retrolisthesis. So what does subtle mean? Well, the report also then went on to talk about dynamic instability, that there wasn't any. Well, that's not true, because that's an oxymoron. Those two are opposites, so they can't both be correct. Does that make sense? Here you have a 4.71 millimeter translation. That is surgical. That is an absolute instability, and I'm going to show you what does that mean. So when the vertebrae are like this, they should line up here, okay? Nice space and open hole here for the nerves to exit, and a nice healthy curve allows the spinal cord itself to pass through smoothly, okay? As this vertebrae shifts down, because disc height gets lost, as it shifts forward or back, you can get compression on the nerve. That happens in about 10% of the case due to the bone. The other 90% of the case is all the soft tissue, the ligaments, the tendons, the muscles, all that stuff gets inflamed, and then you have more compression on the nerves. That is exactly what's happening right here in this x-ray, is that it slid so much that it's now surgical. So you want to get to an expert that not only knows how to read these, and when I analyze this, there's way more drawings on here, there's way more lines, there's way more mensuration done with each patient, especially if they're going through corrective care. But the point is, you've got to go to an expert, a specialist who knows all about the spine, knows how to get it back to normal healthy. That's the person you want to go to. Until next time.